The WHO, who is saying that there could be 10,000 cases a week in West Africa by the beginning of December. 10,000 a week, and 70% of these people will die. Are we losing control of this?
Well, certainly in West Africa, the situation is really critical and acute, and West Africa's got particular problems, Liberia, Guinea and Sierra Leone.
They're failed states, really, aren't they?
Well, they're fragile states because they've got very low GDP, extraordinary poverty, 40% of children are malnourished,
Terrible
stunted,
health system.
And dreadful healthcare systems, almost no healthcare systems. They've been hollowed out completely. So Liberia, with a population of about 5 million, has only between 50 and 100 doctors and fewer than 1,000 nurses. They simply cannot cope at the moment, the healthcare systems.
But if we, and by we I mean the world community, if we lose control of this in West Africa, aren't we then in a domino effect that it begins to get a grip in other parts of Africa, and then it becomes unstoppable as it moves elsewhere in the world?
You're right. The worry at the moment really is in West Africa and in getting the disease under control there, because as we've seen, the more cases we have in West Africa, the greater is the chance that someone will get on a plane with this condition and end up in another country. And that's why, although, as you said, there's a lot of concern in the United States at the moment and also in the UK, this should really help us focus on getting the disease under control in West Africa.
What do we do in West Africa?
Well, we need to do a lot more. And the first thing we need to do is understand the root causes of the disease, because these diseases don't come from anywhere. They're really down to the extraordinary poverty, lack of food, housing, overcrowding, and lack of sanitation and clean water. That's the first thing. The second thing is we've got to put good infrastructure in, and sustainable infrastructure in terms of healthcare facilities and education.
What will that take, though? I mean, I saw some footage of I think it's the British Army we're putting up a healthcare facility. It's still going to take weeks, and then we have to get the health workers. I mean, turning these countries around. I mean, the infection could be out of control before we do that.
Absolutely. This is an important, it's an urgent, and it's an emergency project. And the whole world owes it to West Africa to galvanise, to mobilise, and to put in the resources. Pardon?
It's been slow.
It's been too slow. Absolutely too slow.
But if you take Sierra Leone, which, as I understand it, is the country that the British are taking most interest, the Americans are concentrating on Liberia. You know, we now have a 10, 11 billion pound overseas aid budget, of which Sierra Leone is one of the priorities. We've been putting a lot of money in there, and yet this is still happening in Sierra Leone.
Yeah, I think the priority at the moment, there are clearly longer term issues that Alison was talking about, but the priority at the moment is to get healthcare workers out there, to get the infrastructure supported so that we can actually get this immediate crisis under control. And one of the questions we're thinking about at the moment is how do we encourage more healthcare workers from the UK? A lot of people think about doing it, but what's actually stopping them today signing up? And so this is one of the questions we're actually looking at in our unit in Liverpool at the moment with a survey.
The emphasis, the publicity in the West has been on healthcare workers who've been treating Ebola patients, and then they get it. That must be deterring some people, surely. It's only human nature.
Well, of course it's only human nature. But I think we've also got to think about what's happening to our healthcare systems in the West as well. We've had a few cases now, one in the UK and a couple in the US, where we see how important it is to have universal healthcare and to have really good responsive healthcare systems. Part of the fiasco of what was going on in the US is that they've been actually eroding and hollowing out their public healthcare systems.
But that's not the reason why 2 people got it.
Well,
I mean, you're making a political point.
No, I don't. I think there is. I think it has contributed to some extent. So
why? To 2 people getting it?
In the UK, we've got a healthcare system where we're able to say this is how we need to train our healthcare workers, so that even when a patient arrives with Ebola, we have a system in place that people are trained to look after them.
Most Western economies have done that.
I don't think the Americans had quite done it in that way before these cases arrived.
Are you confident that we know what we're doing?
I think we do know what we're doing.
You sure?
I don't think we will be able to necessarily stop a patient arriving in the UK with Ebola, but I think we've seen from the nurse who came back with Ebola, and indeed from previous hemorrhagic fever patients we've looked after in the UK, that we do know how to look after these people and minimise the risk of the disease spreading to others.
Is this screening at the airports, is that just symbolic, or does it matter?
Well, You have to look at the evidence around screening, and Tom may be able to contribute more, but you've got entry screening and exit screening, exit screening and entry. And there are there's real doubt as to whether entry screening is worthwhile. The European Centre for Research into Infectious Diseases Prevention has just issued a report on the 12th of October saying it casts doubt on the value of entry screening. Because of the low prevalence of the disease, the
Or you could
risk
have
of
it and the screening wouldn't pick it up.
Yes, that's false negatives, but also false positives, that you might actually have a lot of people who've got temperatures,
But
you
they don't
quite
have
know
Ebola.
what to do with it. So they're not recommending screening.
Yeah, I think that the issue about screening, we've done work in Liverpool. It's shown that screening people when they come to the UK, there's a small chance it will pick up a tiny number of people who would have been missed, because there is screening when people leave West Africa. But I think the benefits of this programme...
It's also easy to get out of West Africa without being screened.
Yeah.
The borders are porous.
Not by flights, actually.
But you go
And many of the borders are
but
closing at the moment.
But I think the
people can
advantage,
get through these
I think the advantage of the screening in the UK is more than just that. What it means is that somebody getting off a plane from West Africa today, even if they don't have a temperature, they've made contact with the health services. They've been told what to do if they become unwell in the next few days. And importantly, if there's a real worry about them, they'll be telephoned every day for a couple of weeks to say, how are you feeling? And it means then that when somebody has got a fever, we'll be there very quickly to look after them.
That's reassuring, but we keep on being told it's actually quite difficult to catch because it doesn't come through the air. Just contact alone is...
Through bodily fluids.
It's bodily fluids. But an awful lot of people seem to be catching it.
Yes, not at the rate as if compared with measles. So the risk
Which comes through the...
so it's actually not a very contagious disease. It's transmitted through bodily fluids when the disease is actually active, not during the incubation period, and that's really important.
It's simple. What that means in simple terms is the only people who are catching Ebola are those who have been looking after somebody who's ill with Ebola.
I understand
and that's what the public need to remember. I've read all sorts of nonsense, even in a paper I think that you were associated with previously, The Times.
No, it was the Sunday Times I was associated with, and it was 25 years ago, so I don't think we need to go there.
Are
you worried?
Yeah.
Are you worried?
I'm worried for the people of West Africa, certainly.
But just West Africa?
And what I hope is that any anxiety that people have in this country will be directed towards looking after the problem in West Africa.
All right. Well, thank
and
you
our
both.
resources as well. We need to build up the public health systems there.
It's not often we have two professors on the programme at the same time, so it must be really important. Thank you.
Thank you very much.